I'd like to take a moment to introduce to you a few of my initiatives as your County Superintendent of Schools. One of the initiatives that we're focusing on this year is on mental health. This pandemic has presented many challenges to students, educators, and parents. Children already coping with mental health conditions have been especially vulnerable to the changes brought forward as a result of schools being closed. Students have faced isolation and other unexpected changes to their lives. Over the last year, both students and adults have experienced higher rates of depression, anxiety, and self-harm. Therefore, mental health services and support are very important right now as schools reopen for in-person or hybrid instruction. School districts are also working towards addressing the needs of the whole student beyond the classroom, and we intend to come alongside them and support those efforts on a county-wide basis. This year, I convened a committee focused on addressing three areas: trauma-responsive practices, social and emotional learning, and universal design for learning. The committee met with the Riverside University Health System to create a partnership to provide free professional development to our districts and charter schools. The group held and recorded 3 separate trainings for educators, and more are planned throughout the year. In November, the first meeting of the Mental Health Task Force was held with the goal that every student in the county who needs mental health care would have access to equitable and high-quality services. An online mental health resource center was also launched on the RCOE website as an immediate response to the current level of need in Riverside County. Furthermore, a virtual mental health conference titled Rejuvenate was held this March to provide students and families the opportunity to discuss the impact of social distancing, and students were provided resources to help navigate some of the challenges that they are experiencing. And so, we look forward to continuing our focus on the mental health of our students, families, and staff as schools return to in-person instruction. Let's hear a first-hand account from one of our students on this very important topic.
I think mental health is just something that is so important that we don't talk enough about, especially in youth with kids and in high school kids. But I'm even saying younger, like, there's some things that I've heard, and I've even me having being as a younger kid, I've gone through that nobody wants to talk about. I'm sure there's elementary school and middle school kids who have family issues, all kinds of different things that they have to deal with that affects them mentally. This is all new to everybody. No one prepared for this. No one expected this. You add on what you're going through at home, and you're adding on what's going on at home and what's with your friends and what's going on with a growing student, someone who's changing and still, growing up every day. And then you add on the pandemic and online learning, and it just becomes this whole big thing of just constant stress, because there are so many kids who don't talk about their issues. There's so many kids who are scared to talk about their issues. There are so many kids who don't trust anybody to talk about their issues. You can be in a tough situation, but you are always strong enough to overcome it, and you can always get through it. I can't think of a moment in time where I felt so low that I couldn't be able to get through it, because I have. And it never was always on my own. I've always, I've had people help me. I could do something like that and help, because I want everybody to succeed, and I want everybody around me to succeed. So if you need help, you can get the help, and you can reach for help, and people will help you there.